this is essentially what a healthy, stretched lobe would look like. And this is what this lobe looks like after the ulcer heal. I mean, I don't want anybody to grab hold of it because I might lose the whole ear.
It's time to react to some crazy and fascinating medical TikToks. And these are actually TikToks from doctors who are good friends of mine. Let's go.
You may have seen Shakisha in the last season of Dr. Pimple Popper on TLC and Discovery Plus. She had really ripped this earlobe and there were ulcerated edges. She actually had to cover it with a Band-Aid like this. She wanted to preserve her stretched earlobe though. Normally I would repair this and recreate a normal appearing earlobe, but I had to do something a little different here. So this just requires me to refresh the wound edges so they stick together, and I sewed it together just like that.
It's been about 2 months since I got my ear repaired. Look at her, look at how cute she is. She's so little. I'm super stoked. I can't wait to put new jewelry in.
This is called gauging of the ears, where somebody puts in an earlobe piercing and gradually enlarges the gauge to the point where the earlobe becomes so stretched out, it looks like that, like a spaghetti noodle. I have repaired a number of these in my office, but I've never actually had somebody break one and have it put back together. The main concern with that is when a new gauge earring is placed in there, the actual closure, the skin that has been closed together, that scar, is about 80 to 85% as strong as the skin surrounding it. So there's always a risk that that can re-tear again, so she needs to be super, super careful with when she puts earrings back in.
Here's how to simplify your skincare routine. There are only 3 products that you actually need: a cleanser, a moisturizer, and a sunscreen. Everything else is just extra and should be tailored to your specific skincare concerns. So tranexamic acid, this is for hyperpigmentation. If you don't have hyperpigmentation, then you don't need it. Now add ingredients that target your specific concerns. For example, retinol is the most powerful anti-aging ingredient. Your skincare routine should be unique to you, so save money and have better skin.
I so agree with my buddy here, Dr. Munib Shah. You don't need to use a ton of products on your skin. And if you're having issues with your skin, if you're having breakouts, if you're dealing with a lot of eczema, inflammatory types of issues, then one thing that you can try is going off of a lot of your products. Sometimes by layering product after product after product onto your skin, you can cause your skin to have issues. So getting back to the basics, like you said, cleansing, moisturizing, and sunscreen with the potential addition of a retinol is a great way to start your skincare routine. What is going on here? These are old silicone implants, and there's a shell, a scar around them called the capsule. A lot of times with these old types of implants, that capsule can get so thick and hard it becomes calcified like the shell of an egg. And the implant inside, that's silicone bleed. The old silicone implants, the silicone was a liquid, and it would actually bleed through the silicone shell, leaving this kind of slimy coating on the surface. It's really gross. The silicone implants of today are called low bleed implants. They don't nearly have this amount of silicone that has gone through the shell, but there still can be a little bit. So it's very important, if you're considering breast implants, be educated, see a board certified plastic surgeon, and make sure the surgery is the right thing for you.
Hey, mind if I come in? I was just hoping I could talk to you for a minute.
Yeah, sure, Dad.
This isn't easy. I was going through your bathroom and I found something that really concerned me. I found this St. Ives scrub.
It's not mine, it's Mackenzie's. I was just holding it for her. I've never touched it in my life.
Dermatologists seem to hate St. Ives scrubs. These are scrubs that have little particles in them that are very abrasive for the skin. So they're very effective at exfoliating the skin, but you can get what are considered micro tears into the skin from those aggressive particles. So it's become kind of a joke online. All the dermatologists seem to hate the St. Ives products, and so they rip on them, and hence this video.
Does eating burnt, charred, or barbecued meat cause cancer? It turns out that that is a risk factor for cancer. So if you do get beef that is burnt or blackened, I always recommend just cut those bits off just to be extra safe.
This is true. When you char your meat, you do create free radicals and other unstable molecules that can be potentially harmful to your body. And this is why removing those charred bits of meat can actually be better for your health and hopefully help to lower your risk of colon cancer in the future.
I mean, I get that I want you guys to ask me questions, but ask me legitimate questions. This is a ridiculous question. I'm not even going to entertain answering it.
Maybe somebody should tell Dr. Schulman that the diaper has to be on the inside of his scrubs, not on the outside. So what happens when you're doing a long operation and you have to go to the bathroom? Well, it is very simple. We put catheters into our bladders to drain our urine while we're operating. No, that's not true. We actually unscrub, we remove our stuff, and we go to the bathroom quickly and come back. There's some operations I do that take upwards of 5 hours, and usually I hold it the whole time. But every once in a while, if I've had a little bit too much to drink, I do scrub out, I zip to the bathroom, I drain my bladder, and I come right back in. So that happens occasionally, but I don't recall ever, honestly, having to go number 2 during a surgery. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
Don't think you need a fancy long skincare routine for it to be good. Most days I just cleanse, retinoid, moisturize, and that's it. Then I go to bed.
So in the morning, you want to cleanse your skin, ideally apply an antioxidant serum, and then a sunscreen. That's all you technically have to do in the morning. You can add more stuff if you want, but that's the basics. And at night, just what she said. Cleanse, apply retinoid, moisturize, and go to sleep. There are times when you take care of patients where ideally it would be great to do a 3-minute scrub, put on sterile gloves and a gown, and then do a procedure. And that's the way it goes the vast majority of the time. But every once in a while, if we're in a really, really hairy emergency situation, I throw gloves on and just get things done. You know, there's always a risk of infection if you don't do all the scrubbing, but if somebody is literally about to die or if they're hemorrhaging, they're bleeding, then that's what you have to focus on at that time. You can worry about infection later. Now, how many times has this happened to me in the last 17 years of private practice? Literally, I think maybe twice. If you've watched my TikTok reactions, you know that we always end with a couple of my own TikToks. So let's watch. Hi Judy, what brings you in today? We want her to have breast implants. So what size do you think you may want to be, Judy? Well, we want her to be a double D. So double D, that sounds pretty good to you, Judy? Yeah, that's what I said, double D. We want a double D. Well, that sounds okay. Well, in the meantime, though, will you please shut your pie hole? This is one of the things that drives me crazy when I'm doing consultations. 90% of my patients are women, and sometimes they bring their husbands, and I'd say literally like 95% of them are great guys that are super supportive, and they're just there to support their spouse in whatever they feel they want to have done. But there's that like 5% or less of guys who seem to care more about themselves than their spouse. And so they'll say things like, we want her to be a double D, you know, I think I want her to be this. And it's like, dude, it doesn't matter what you want. This isn't your body. This isn't we, it's she.
So Courtney, you can shower 2 days after your surgery. Oh, wait a minute. I got an important question. When can we do it? 3 weeks, give or take. So after you shower, what you want to do is, oh, wait a minute. 3 weeks? How about 1 week? I can't wait 3 weeks. She needs time to heal. Okay, so you pat everything dry after you get out of the shower. Oh, wait a minute. How about if she just gives me, So then you pat it all dry and you put the dressing back on. Hey, I am so not okay with this arrangement. I'm sorry to inconvenience you and little Billy with your wife's surgery, but maybe instead you should marry your right hand.
Yes, husbands and boyfriends ask this quite commonly, but usually it's more in a sheepish fashion because they do want to know, and that's okay. It's just in this situation, and not often, but every once in a while, the guy is so fixated on getting it on, he just can't get over the fact it's going to be a few weeks, and that's okay. So hopefully you found these TikToks educational. But what about TikToks that are absolutely insane? Take a peek at this playlist right up here where I react to TikToks that will absolutely blow your mind. And if you've been enjoying my videos, please subscribe to my channel. And always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.